If you pay attention, and I hope you do every day, you'll note that we have a number of eye specialists on here. And I think one of the reasons we do that is because of the fact that most of us just simply don't go enough. We don't take care of our eyes well enough. We take them for granted, and then all of a sudden when we're doing this with a menu or a newspaper, we say, well, I'm going to go to Walgreens and get some glasses, right? Well, there's a lot of other things to be concerned about. Dr. Mark Jaffe is here to talk to us about it. In practice where?
Glendale, Arizona.
And we are not only delighted to have you here, but we're particularly delighted because we're going to be talking about glaucoma. What does that mean?
Well, glaucoma is an eye disease that is fairly prevalent in the world. As a matter of fact, it's the second leading cause of blindness.
Everywhere with the same commonality?
Pretty much. It's age-related to a certain extent, so a little older and a little more prevalent, but yeah, even as an infant you can get it.
So if I have it, or if I'm going to have it, how will I know?
Well, there are two types of glaucoma, and the most common type you probably wouldn't know early on. It's a type that is very slow and sort of sneaky, insidious. There's no pain. And the vision loss is not something you're aware of because it's not your central vision that you lose initially.
All right, but when you're talking about glaucoma, most of us hear the word, have absolutely no idea not only what it consists of, what the symptoms are, but we also don't know who's high risk.
Well, in order to determine risk, of course, you look at the family, but the best way to determine your risk is to go in and see your eye doctor. An annual examination basically screens for glaucoma, and if you are at risk, that's the best way to find out.
And there's no indicative sign that I can say, wait a minute, hold it, that Dr. Jaffe was on and he was talking to Pat about this, and that's what I'm feeling or recognizing or seeing right now.
Well, as I say, the most common type of glaucoma is painless, but there is one type that occurs in about 10% of the cases where there is and can be extreme pain, foggy vision, nauseousness, dizziness, and that type of glaucoma is what we call closed angle. You have to get in right away. That is an ocular emergency.
All right, so I go to my doctor. Hopefully I know who my eye doctor is. If not, you can check out our website, the doctor's websites, because there are specialists across the valley. There's a phone number. There's a website for you, and if you don't happen to have that handy or if you can't write it down, we'll carry it on aztv.com. When I go, do I just simply say, do you mind giving me a glaucoma test, or is it kind of automatic?
It's pretty much automatic. A comprehensive yearly exam includes a screening for glaucoma. We run a couple of simple tests to check the pressure in the eyes and to look at the nerves to see if they look in any way damaged, and that's how we screen for it in most cases. We also do a simple test to check peripheral vision.
Telling you what?
Well, if you have glaucoma, usually you lose side vision before you lose central vision. And it's sort of gradual, as I say, so this test is a good screening test.
Can a child ever suffer from glaucoma?
Yes, even an infant can suffer from glaucoma.
Really?
Oh yeah. The risks are certainly, as I said, higher as you get a little older, but you can suffer from glaucoma at any age.
So tell me about the treatment. If I go to my doctor and he says, you know what, we see a little onset here. We're beginning to see some signs. Then what?
Well, what the doctor will generally say is that you're a glaucoma suspect, which is there's a suspicion you might have or shortly develop glaucoma.
Because of genetics?
Well, genetics is one, family, and the findings during the regular exam, and they'll usually have you back for a full glaucoma workup, specific tests, specific equipment, and if you have glaucoma, there are treatments. The most common treatment would be eye drops, a wide variety of eye drops, and there are different types of surgery that can treat it also.
Always in one eye?
Usually it starts in one eye, but if you have it in one eye, the likelihood is you may develop it in both.
All right, so once I have that diagnosis, and I know that at least I have early onset glaucoma, can it be stopped, or is it just going to be slowed down?
Well, we can slow it down and control it and usually keep the person's vision for the rest of their life. But it's not curable. We can't magically make it go away, and we can't retrieve vision that's lost. That's why it's very important to get in for your yearly exam and catch it as early as possible.
And the medication has proved to be successful in most people?
Very effective. Every few years, a new type of medication comes up, and the main purpose of the medications is to lower pressure and to reduce the damage to the nerves, and it works quite effectively.
Almost everybody on this show, with the possible exception of me, works out pretty regularly. Angela climbs mountains. She did Kilimanjaro this morning after breakfast. I mean, it's laps and swimming. Laura, my producer, Lisa, my other co-host, all of them working out like mad, right? Is there anything that we can do to exercise our eyes to make sure that I have the healthiest set of eyes possible?
Well, as far as glaucoma goes, there's no real exercise or vitamins that we're aware of that can prevent it from happening.
But I'm talking about overall. I'm talking about overall eye health to help prevent any condition.
I think the most important thing is to get your eyes checked, and that's what I would recommend.
All right, but okay, I'm going to pursue this because I thought of it this morning, and I thought, well, wait a minute, hold it. I was always told, and we are still told, that you can do eye exercises and that it can help you avoid eye fatigue. Do you believe that?
To a certain extent, yes. Not a cure-all for diseases, but certainly by focusing at different distances, relaxing your eyes, not working for long periods at any fixed distance, you can help yourself a little.
All right, so the best thing we can do to avoid an unchecked glaucoma reading is first check with other family members if you have an opportunity to do that. Would that be early on?
A good idea.
High priority. See your doctor, right? Another priority. And then if I have advanced glaucoma, will the medication work under those circumstances?
Well, to a certain extent, in this country, eye drops are very effective, but in severe cases, sometimes surgery is required, and there are a variety of surgeries that are available that can help reduce the damage to the nerves.
And I'm told that before you choose your own eye drops, it wouldn't be a bad idea to ask for the advice of your eye doctor, because there's good drops and there's bad drops. There's good second basemen and there's second basemen that are probably not going to stick around too long. What is he talking about, second baseman? Sports is coming up next on the McMahon Group.